Okay, first, I'd like to start just by thanking you for coming out to open enrollment tonight. We will try not to hold you long, get you all the information that you need. I'll start just by introducing who's in attendance tonight. Of course, if you don't know who I am, I'm Donita Steens. I am your HR director. Tonight, we will have with us Gregory and Appel, who's represented by Chad Morris and also Nick Napier in the back. They are new brokers to us this year. We also have Michelle Ware, who's in the back, and she is representing Community Health Network, who's part of our clinic that we've started this fall. We've got some other representatives for our HSA accounts, relationships that we have, and that's with KeyBank. And we have, we have Billy Lester, who's out in the front for KeyBank, and we also have Barbara Wood for the Financial Center. Josh Ward is here for Nationwide. So they'll be available for you to answer questions for you after we're done. And we'll just kick it off with Chad starting. Thank you.
Okay, well, thank you, Donita, and good evening. It's good to be with you all this evening. Again, my name is Chad Morris. I'm from Gregory & Appel Insurance. We're located here in Indianapolis and excited to partner with you guys this year. I want to start with some highlights. First of all, the medical insurance carrier will remain the same. So the plan is administered by Anthem Blue Cross Blue Shield, so good news for everybody, right? Lots of doctor options, very broad network. There is a slight deductible plan adjustment on the high deductible healthcare plan, we'll go over those details here in a couple minutes. We are going to be moving to a matching arrangement on HSA funds, so if you're on the high deductible healthcare plan today, we'll talk about how that changes tomorrow, but essentially the city is going to be doing a matching program with the HSA. I want to report that the qualified health activity incentive remains in place, so that's good news for everybody. And the Lawrence Health and Wellness Center has been launched. I believe that went into effect in September. So if you've not been to that facility yet, highly recommend that you get over there because it is a beautiful facility and I think it's going to be a great benefit to the City of Lawrence employees. The HR administrator is changing from Right Choice to EBC. It's the same administrator as our FSA administrator, so that kind of streamlines some efficiencies, not only for you, but for the HR department. And good news, the dental annual maximum is increasing from $1,000 to a $1,500 annual max. So that's really good news. What was happening was you guys actually were going to receive a dental decrease this year. We were able to still get that decrease, but also enhance that benefit. So you actually get an extra $500 in annual benefit on the dental plan. So it's good news for everybody in this room. Also, we have a new enrollment system this year. It's the City of Lawrence HR portal via eSuite. And we'll be talking about later what you need to do there to enroll for your benefits. Okay. So let's do a medical and prescription plan comparison. I know that the font is very small behind me, so if you could pull up your open enrollment guides and maybe follow along. I believe it's on page 3. But we're going to talk about the two different plans. So just like last year, we do have two plan options. We have a PPO plan and a high deductible healthcare plan. Both have attached account arrangements to them. One is a health reimbursement account, or what we refer to sometimes as an HRA. And then we also have a health savings account that's attached to the high deductible healthcare plan, or sometimes referred to as an HSA. The PPO plan has a $1,750 individual deductible and a $3,500 family deductible. You then pay your co-insurance 20%. The plan pays 80%, all the way up to $5,000 for an individual or $6,850 for a family. Once you hit your max out of pocket, everything else is covered at 100%. Compare that to the high deductible healthcare plan. The deductibles are fairly similar, as are the max out of pockets. The individual deductible is $1,500, and again, that's slightly up from $1,300 a year ago. The family deductible is $3,000, which is up slightly from $2,600 last year. So those deductibles changed a little bit. The max out of pocket's the same as the PPO plan, $5,000 for a single coverage and $6,850 for family coverage. When it comes to preventive care, if you need to go for an annual physical, a mammography, a colonoscopy, child immunizations, all of that kind of good stuff, that's all covered at 100% regardless of which plan you choose. But really where these two plans differ the most is how the copay arrangements work. So I want to spend at least a couple minutes here explaining the difference. On the PPO plan, the traditional plan, you have the traditional copays that you've probably been used to in the past. That's a $35 copay for a primary care office visit. It's a $50 copay for a specialist visit, and a $100 copay for an urgent care visit. Now, when you compare that to the high deductible healthcare plan, it operates a little bit differently. When you're on the high deductible healthcare plan, you'll pay the network negotiated rate for that office visit. All right, so whereas on the PPO plan, you pay your copay at the time of the visit, when you are on the high deductible healthcare plan, you'll actually pay nothing at the time of the visit. The claim will be submitted to Anthem. You'll receive, of course, your EOB and a bill that you'll have to pay eventually, 30 to 45 days down the road approximately. And the cost of that office visit could range anywhere between $120 to $160 retail, but when we apply the Anthem discount, it'll actually net out to around anywhere between $70 to $90 wherever you go. So that's one of the big differences. If I'm on the PPO plan and I go to the doctor for a non-preventive reason, like I have a cold, something acute in nature, I'm going to pay $35. Or if I go to a specialist, it's $50. But if I'm on the high deductible healthcare plan, it is going to be a little bit more expensive for that visit. Okay? But what I would challenge you guys all to think about, and I want to stop right here, because oftentimes when people hear that, they think, I don't want to be on the high deductible healthcare plan. If it's going to cost more every time I go to the doctor, why would I ever choose that plan? So what I want to challenge everybody in here to think is just think a little bit differently. Try to think about it from a total package scenario. You've got your deductibles, you have your max out of pockets. Yes, you have the office visits, and those operate a little differently, but then you have your premium differentials too. So when you're thinking about your healthcare needs, try to think outside of just how much does it cost every time I go to the doctor. Try to think about, well, how much in expenses do I have every year? You know, how much am I paying in through payroll deduction? I mean, try to look at the complete picture, okay? Inpatient and outpatient services, I skipped emergency services, excuse me. Emergency services is a $250 copay. And I do want to mention, this is a different policy for Anthem this year. This is mentioned in a later slide as well. If you go to the emergency room for a non-emergent reason, your claim could get denied, and you'll be responsible for 100% of the cost. So if you have a cold and you go to the emergency room, you may be responsible for 100% of the cost. Now, there are some exceptions to this, and I'll go over to that here in a little bit. But this is a new policy for Anthem as of January the 1st. They're really trying to crack down on non-emergent services being performed in the emergency room, and we know it's so much more expensive when it's done in the emergency room. The good news is, you guys have so many different access points that are either no cost or low cost for you guys to access care that really this shouldn't be an issue for City of Lawrence's employees. When we talk about inpatient and outpatient services, handled the same way, right? You actually go, pay up to your deductible, then you do your co-insurance up to the max out of pocket, covered the same way on both plan. Preventive prescription drug coverage, this is a really nice benefit for you guys. Regardless of which plan you're on, your preventive medications are covered at 100%. I got to tell you, that's very unique. So that's a very nice benefit to you guys. If you're on the PPO plan, however, and you're getting a non-preventive drug, it operates a little bit differently. The PPO plan is kind of like the old traditional drug card you're used to, right? It's $15 for a tier 1 drug for a 30-day supply, $50 for a tier 2, $80 for a tier 3. If you have to have a specialty medication, which by the way, specialty meds can run almost $5,000 a month. I mean, they can be that expensive, sometimes more. But if you have to be on a specialty med, you pay 30% of the cost up to a $225 max. Compare that to the high deductible healthcare plan, kind of like what we were talking about earlier about the office visits. You pay the network negotiated rate for drugs. So when you're on the high deductible healthcare plan, it really pays to shop around. And it's really going to be beneficial to get generic medications. You can ask the doctor at the time that they write the script, is this a generic medication? If you forget, which has happened to me several times, you can actually ask the pharmacist at the pharmacy, is this a generic medication? And if they say no, and there is a generic equivalent available, they can actually then call the doctor's office from the pharmacy, get approval, and switch it out for you right there. And I've done that myself. A non-generic medication, just want to make sure we're setting right expectations. If it's a tier 2 or tier 3 drug and you are on that high deductible healthcare plan, it can run over $100 for a 30-day script. It could be $250 for a 30-day script. I mean, the price of drugs are really expensive. So you want to make sure you get generics, especially if you're on that plan. Okay, they can be as low as $4 at Target, Walmart, Kroger, and other places. We do have mail order available on both plans. Of course, on the PPO plan, it's available through a copay arrangement, and same thing that we were talking about earlier on the high deductible network negotiated rate. But the mail order drugs is a great way to do it. You usually get a 90-day script for about a 60-day price. Any questions for me on the plan design? Okay. We mentioned the qualified health activity incentives are in place. I think that's a really great thing for you guys as well. To receive the incentive, each covered employee, and I want to make sure I'm clear on this. Donita, does the covered spouse have to complete the annual physical exam as well?
Yes.
Okay, so we had a question on that in the previous session. I just want to make sure we answer that correctly. So you, or if you have a spouse on the plan, you do have to complete an annual physical, and that needs to be done by 12/31 or December 31st of this year. If you do that, you're eligible to receive either funds in your HRA if you're on the PPO plan, or your HSA if you're in the high deductible healthcare plan, and those details are outlined here below. The amount is the same regardless of which plan you're on. The contribution to the PPO and HRA plan is $600 for employee only and $1,200 for family coverage. But I want to note, you have to satisfy, if you're on that PPO plan, the first $750 for single coverage of that deductible, or $1,500 for family coverage, of course, the deductible, before you can utilize any of those funds in your HRA account. And I've got a slide that will help represent that after this. If you're on the high deductible healthcare plan and you use the HSA, it's the same dollar amount, $600 for employee coverage, $1,200 for family coverage. But what's new this year, that's different from last year, is that if you're on the high deductible healthcare plan with the HSA, where last year you might have gotten those funds automatically, this year there's a change, and you actually have to put in money to be able to receive money. And the city is willing to do a dollar-for-dollar match up to a cap of $600 for single coverage or $1,200 for family coverage. Now, I know that's confusing, so I want to repeat. You have to put in your own money, and then the city will put in a contribution as well. It's a dollar-for-dollar match up into a cap of $600 for individual coverage and $1,200 for family coverage. Now, you can put more money in your HSA than $600 or $1,200. You can go up to the IRS maximums, which is over $3,400 for an individual and $6,900, I believe, for a family. So you could put more money than that in there. But the city is going to cap their contribution at $600 for individual coverage or $1,200 for family. Yes, we've got a question.
So you still get the 600 for the gold plan, and then you can get an additional 6 if you put in one?
Nope, you've got to complete the qualified health activity. So you have to do that, and then you have to put in a contribution yourself in addition to, right? And so then the city will match your contribution, again, up to those cap amounts. So it just requires you to do an extra step as opposed to what you were doing last year, and that's just you've got to contribute your own money too. And oftentimes, many people are contributing their own money to the HSAs, so that might not be a problem for a lot of people. But if you used to put no money in your HSA, and you just got the city's contribution, well, this is going to be different. Does that make sense?
Where's this information you're talking about now?
So it's in your benefit guides,
Where?
and it's notated on the last bullet point up here on the screen. And we do have some more information in here. It would be located in your benefit guide. And let's see what page that would be on. 6 and 7. Okay, thank you. So I want to go back to the HRA because it's kind of confusing when we say that you have to satisfy that upfront part of the deductible. So I just want to show you a visual representation of what that would look like. So if you choose the PPO plan with the HRA option and you complete your qualified health activity, again, if you're on the single coverage, you satisfy the first $750, so there's some skin in the game for you. And then the city will contribute the next $600. And then after that, if you eclipsed your deductible of $1,750, in that scenario, you would pay the next $400. Does that make sense? So it's like, it's layered, right? So I'm gonna say it again because I just saw a head go this way. So in an instance, let's say you had $2,000 in expenses and you're on single coverage, okay? It was a surgery. In that instance, if you completed your qualified health activity, meaning you went and got your annual physical, so we're showing that you're eligible for the $600 in funds, you would satisfy the first $750. That comes out of your pocket. You pay that towards your deductible. And then the city would come up with the next $600. And then anything over that, so in the example of a $2,000 bill, there'd still be more to pay, right? So then you'd pay the remaining $400. So it's just kind of, it's like a layered in the middle. Does that make sense? Okay. And then family coverage, you pay the first $1,500. And then the HRA contribution is $1,200. And then of course you'd pay anything over that. Okay. And that'd be an example of you have a, a pretty big bill, right? Doesn't happen for all of us. Any questions on that? Okay. We mentioned earlier the HRA administration is moving from Right Choice to EBC. That's, again, the same vendor that does the FSA administration. There is a change this year. You do need to submit your EOBs to EBC to get credit, all right? And we're going to have a lot of more information. We're going to be doing some more education about that. But you want to keep your EOBs, or you can access them through Anthem. There's many ways to submit your claims. You can use, you can submit them online through the My Account Assistant. You can also use your mobile app. There's a downloadable mobile app where you can actually take a picture of the EOB and then you just submit it that way. And that's a great way to substantiate FSA receipts too, and that's really the future. So anytime you got to send something to an insurance company, that's going to be really the preferred way to do it, is to use the app, take the picture, and send it on its way, right? But there's many different ways to do it. You can also mail it in, you can fax it in, lots of different options. You can also carry over unused HRA dollars from year to year, up to a max of $1,500. So again, more information coming soon with this, and Donita, of course, is always available to help support in this effort, and happy to answer any questions on this as well. All right, so the HSA accounts. So I just want to make a quick mention, if anybody's curious. As the city of Lawrence, we have about 50% of the population on the high deductible health care plan. And then we have the other 50%, of course, on the PPO plan. So it's pretty split. So if you're one of those people that have been very hesitant to move to the high deductible health care plan, I would just encourage you to take a hard look at it this year. It's really, really attractive. And if you're going to be on the high deductible health care plan, strongly advise opening up an HSA account and putting money in there pre-tax. And so now we're going to go over some details on who's eligible for an HSA account, how they work, how you can use the money. So we're going to do some more education on that. So who's eligible for an HSA account? It's any individual that's covered by a high deductible health care plan, that's not covered by any other health insurance, it's not enrolled in Medicare, and you cannot be claimed as a dependent on someone else's tax return. Children cannot establish their own HSAs. However, spouses may be able to establish their own HSAs. Contributions can be made into the HSA by the employer, individual, or others. It's made by the employer. It is not taxable to the employee. Okay, and just a reminder, City of Lawrence will do a dollar for dollar match, up to $600 for single coverage, and up to $1,200 for family coverage. So it's capped, and then you can put any more money in over that. Okay, but you got to put in an amount to get the city match. If made by the individual, it's also tax advantaged. The most common way to do this is pre-tax through payroll. Okay, but oftentimes I get a question, what if I have a bill and I don't have enough in my health savings account to pay the bill? Okay, a couple different ways you can go there. One would be if you have enough lead time, it's a scheduled surgery or a major event. Maybe it's a pregnancy situation and it's a delivery. You've got time. You can actually notify the payroll department and you can adjust your contribution to the HSA account. Okay. The other thing you can do is let's say the bills, let's just call it $500, and you only have $250 in your HSA account. So pay the $500, grab the $250 out of the HSA, and grab the other $250 out of your normal checking account. Of course, pay the bill. And then as your HSA account fills up over time, you can actually pay yourself back from the HSA. Okay, that's fine, and that's a very common way to do it as well. If you don't want to worry about paying yourself back, you can actually then get your credit on your year-end tax return. That's another way to do it. Okay, so lots of different ways to get the tax advantage there. We mentioned earlier that the IRS sets caps on how much you can put into your health savings account. That's $33,450 for self-only coverage and $6,900 for family coverage. So remember earlier we said we're on this matching program. So if you put in $600, the city will put in $600. City caps at $600, but that's only $1,200, and you can put in up to $3,450. So you got to make the choice on how much you want to put into the account. Okay, and you can do it again up to $3,450 for single coverage and $6,900 for family coverage. If you're above the age of 55, you can do an additional catch-up contribution that's allowed annually, and you can put in an additional $1,000 pre-tax. So how do we get the money out? What do we use it for? Well, you can use the money for any qualified medical, dental, or vision expense. Not only can any person that's covered by the high deductible healthcare plan use your HSA funds, but this is kind of not widely known. Actually, anybody in your internal family unit, spouse, kids, etc., they can use your HSA funds too, even if they're not on this health plan or even on a high deductible healthcare plan for that matter. So a real practical example I can use is my own. So my wife is on a PPO plan at her place of work. I'm on a high deductible healthcare plan at my place of work. We choose to go separate because that's what's most beneficial for us. We actually have a strategy where we fully fund my HSA pretty much every year. And then we pay all of our family's medical bills out of my health savings account. Okay? And so it's for my wife, my stepdaughter, and myself. So any bill comes in, gets paid out of my health savings account, even though my wife is not on my plan at my place of work. So there's lots of situations where that could be beneficial, definitely. What if you use your funds for something other than a qualified medical, dental, or vision expense? Well, if you get caught and you get audited by the IRS, you'll have to go back and pay the income tax you avoided at the start, plus a 20% penalty on top. Do not recommend that. Plus, I will tell you, debit card technology is getting a little smarter. Chances are if you go try to buy a flat screen TV with your HSA card, it would get declined at the register. So I don't know, Barbara, has that been your experience in the past? Are debit cards getting smarter? Yeah.
I don't see it being limited.
Yeah. In terms of being declined for buying non-qualified? Yeah. Oof. Well, so you're playing with fire if you decide to do that. So, Barbara, we're supposed to tell them, that it will get declined,
You don't want to
so.
do it. Don't use it for qualified money.
Yeah, definitely want to use it for its intended purpose. There's no use it or lose it rules. Money rolls over from year to year with the HSAs, so it's not like an FSA where you have to use your funds and then they go away at the end of the year. So that's good news too. So, personally, I have a strategy in our family where, we want to have 2 times our deductible or 2 times our max out of pocket rather, and we want that money sitting there in the event we have a bad health year in our family. But each person will have their own saving strategy. But I don't want to overfund it, right? Because, that's less take-home pay to me, right? So just as an example. You should keep receipts if you're on a health savings account, because if you were ever audited by the IRS, you'd want to be able to prove that, hey, I use these funds for your HSA. So I want to make sure you keep it. I use those funds for qualified medical expenses. You will have to fill out a tax form. It's the 8889 form, but please don't let this scare you. TurboTax should prompt you for this. If you get your taxes done HR block or a CPA, just tell them you're on a health savings account. Your bank will actually give you a year-end statement that helps you complete this form. Very, very easy to complete. So don't let this scare you at all, okay? If you're choosing a high deductible healthcare plan with an HSA plan, please don't forget to open a bank account. You're gonna need to return an HSA authorization form as well to payroll. You may set up your account at the banking institution of your choice. However, the city has some great partners in Key Bank and FCFCU, who both are here represented today. So there's lots of advantages of partnering with one of those entities, and they've got more details for you. Where to go for care? I think I mentioned earlier in the presentation, you guys have never had more choices for low cost or no cost care. It's a great thing. If you need to get preventive care done, your annual physicals, your immunizations, mammographies, colonoscopies, highly recommend using the Lawrence Health and Wellness Center they launched this year. And Michelle's gonna come up and speak a little bit more about that here in a minute. You can always go see your primary care physician, of course. If you've got routine care that needs to get done, minor cuts and sprains, lower grade fevers, headache, that kind of stuff, and you feel like you need to see a medical professional, again, the Lawrence Health and Wellness Center, a great option. So is your PCP. Maybe even telemedicine, if it's 2 a.m. and you've got a crying baby at home and your baby has a 100-degree fever and you just need to talk to a medical professional. Telemedicine's a great option for that. So that's, we're expecting to see more adoption of that. Urgent care, if you have anything that's, you got a bad infection, high fever, flu, bad sore throat, think you have strep throat, the Lawrence Health and Wellness Center, again, is another great option for that. However, an urgent care center works too. just be a little bit more expensive than the health and wellness center. The emergency care, I know we mentioned earlier, please, please, please just go to the emergency care for emergency situations. Don't go there for non-emergent reasons. But compound fractures, severe pain, burns, head, neck injuries, chest pain. I mean, if it's a true emergency, go to the ER, definitely, right? But if you have a cold, again, don't go to the ER if you have a cold, okay? Again, we mentioned new for 2018, you may be responsible for the emergency room cost if it's not an emergency. I did mention there were some exceptions, so I'm going to go through those really quickly. Exceptions to this rule is members under the age of 14, ER visits directed by your doctor, ER visits between 8 p.m. Saturday and 8 a.m. Monday, and when the closest urgent care center is more than 15 miles from your home. So those are the exceptions, all right? Prescription drugs, we mentioned earlier that all the preventive drugs are covered by the plan at 100%. What a great benefit. But we also have access to the RX Help Center. And I believe there's a page in your open enrollment guide that directs you to the RX Help Center. But if you're on an expensive medication, there's a chance that you could get that medication at little or no cost by working with and partnering with the RX Help Center. So there's a registration process. You can call them on the telephone. You can log in online to get that process started. But if you're on an expensive med, highly, highly recommend contacting the RX Help Center. The Lawrence Health and Wellness Center has select generics available at no cost, and Michelle is going to go over those details here shortly. Then, of course, you have access to a normal pharmacy. It's the Anthem Blue Cross Blue Shield network, big network. Express Scripts is the PBM, one of the largest PBMs in the world. Lots of options on the pharmacy side. So with that said, I'm going to turn it over to Michelle Ware from Community Health. She's going to tell you a little bit more about the Health and Wellness Center.
Well, hello, everyone. I hope you guys are having a good evening, and we'll get you out of here as soon as we can. I know some of you have had the opportunity to come. We had an open house in September for the Health and Wellness Center. It is located right off the corner of Herbert Lord Road and 56th Street. We have a Community Health Network pavilion, and we are the first suite when you walk into the building that faces the door on 56th Street. So basically, the Health and Wellness Center is very similar to what the traditional primary care or your doctor's office may be. We see anywhere from preventative, acute care, chronic care, sprains, strains, flu, any type of complicated chronic disease we can do as well, physicals, immunizations, and we do some on-site lab services. There is no cost to you as the patient. So we will not be filing any kind of insurance. We do just ask that you bring your insurance card when you come in, and that just tells us that you're on the plan, but we will never be collecting any kind of funds from you, nor will we be billing your insurance for any of the visits that you are there for. We do have a dedicated healthcare team, and there are limited generic prescription medications and refills, and I'll go a little bit more into detail in a moment on that. We do also have an online scheduling capability. So in your packet that you would have picked up, there's some instructions in there that you can go online, or we have a mobile app as well. We've got 20-minute rolling appointments. So if you're the night before everything's closed, you're not feeling good, you can go online and self-schedule for the next day when you see an appointment that works for your schedule, as well as calling if you prefer to do that. And also, a benefit are on the electronic medical records that Community Health Network is on, and also nationwide. It's called Epic. So a lot of times, if you are already or have had testing done, if you've had any of that in an electronic medical record on Epic, then the providers there can see that without having to transfer medical records as well. So again, where it's located. And then as you can see, we have 5 days a week access. There's morning, late afternoon hours, midday. So hopefully, again, when you need the care that you need, we can get you in, whether you're scheduling online or calling. Again, in your packet, the listing up here as far as some of the conditions that we can see you for. This is just a very small amount to give you an idea. Also, testing. I wanted to talk a bit about lab testing. So if you are seeing another physician and you have a lab draw that you need to have done, that they're going to send you to a lab, you can bring the script to our lab or to our clinic, call to make that appointment, and then there is no cost to you for the actual lab draw. We use Mackle, and so the only thing that you may see is when we do that lab draw, then we send that to Mackle, and any processing fees that Mackle would normally put through as well, once it's past your deductible or part of your deductible, you may get a bill from Mackle, but the actual lab draw fees, you would not be charged for those. And again, that is one thing that we will be able to take from an outside physician, as well as any lab draws that you may need done from any of our providers. As you can see, a lot of other testing. We can do suture removal. So if you happen to end up in the ER and have some sutures put in, don't want to have to circle back there, you can come in and have those taken out at our clinic. But we do not put the sutures in, but we can take those out for you. So we do have a dedicated healthcare team. This is a private clinic, so it is private to the City of Lawrence plan member population, as well as the Lawrence Township Schools population that is on their plan as well. We have a physician, Dr. Tetrick, and then we have 2 nurse practitioners, Deb Ardell-Sullivan and Alyssa Cohote. And again, they're throughout the week, different schedules. But if you find somebody that you prefer, when you go online, it does actually say who the physician is that you're scheduling with. So you're welcome to select a particular person, or if you just want to get in because you're not feeling good, whatever open appointment is available as well. On the medication service, the way that works is, so on an acute care, so you come in, maybe have strep throat, that would be considered a first fill and a 10-day antibiotic, things like that. We have a generic formulary, and so we keep that on stock in the clinic. You will be leaving the clinic with that medication. Again, there is no cost to you for that. If you are looking at medication refills, so for any kind of chronic care, high blood pressure, diabetic, thyroid, things like that, a few things. If you're seeing a physician at another, one of your primary care physicians, but you see that we do carry the medications that you're on, what you would need to do is call and make an initial appointment for one of our providers to see you. And then you would also need to have them follow you for that condition. So when it comes to a lot of times, like on a blood pressure medication, you may get like 3 refills on that. And then a physician's going to want to see you as a follow-up just to check and monitor how that dosage is working for you. So all of that care would have to be done for the refill service. So one thing that we do not do is we're not a retail pharmacy. So we don't take an outside script, have you bring it in and fill it. It has to be care under one of our providers, but we can also work with a provider that you are already seeing through medical records and talking to one another. So we're not saying that you have to change your care, but for that condition, you do have to be able to see our providers for the condition in order to get those prescription medications. So back to the Epic, that is the electronic medical record system. And again, if you're already on Epic through Community Health Network or some other physician care, our providers are able to see any of the testing that you've had done. Also, we have something called MyChart. You may or may not already have signed up on that. It's free. And it is something that is got a lot of conveniences. You can do messaging on MyChart to your physician. If you are using our refill services, you can use that to just log into your account and then message in that, hey, I'm a week out, I'm going to need my refill, and then the staff can get back and confirm that they've done that for you. You can talk with your provider that way as well. If you've been in to see one of our providers and you have some questions and just want to pop in a quick note, then they will try to get back to you as they can. Other testing that maybe you have done, if they're on Epic, you can see your test results and things like that. So it's got a lot of really nice features. We don't have any bills, obviously, that you would need to pay through the Lawrence Health and Wellness Center, but let's say you have imaging done at one of the Community Health Network facilities, you can pay your bills online as well through the MyChart system. And finally, the online scheduling, just specific to your population. And again, this information is in your packet that you picked up. But if you go online to the website, then you'll see the full access to the schedule. Also online, you can see there's a section for prescription medications. And if you click on that link, it will give you the full list of the current formulary that we carry. So that way you can see if you have something you're already taking from another provider, it would be something of interest, then you can go ahead and schedule to come in and see one of our folks as well. It's got some information about the providers and, again, your scheduling capabilities. So, any questions? Yes.
At some point, do you see expanding the hours of operation?
What we do is we look at utilization, and so when our utilization consistently in the clinic starts running about 85% to 90%, then we start to sit down and talk with the clients about potential of needing expanded hours. At this given point in time, there is a utilization availability, so there shouldn't be any issues with getting in for appointments. But again, that is something that is a partnership decision between us, community, and the client to determine when there is a need to increase hours or not. So, but at this point in time, we're running probably about 75% capacity, so there is definitely open appointment availability.
One more like maybe evenings or Saturdays?
In the future, again, it's just really a matter of a discussion with the client, yeah. Anything else? Okay, thank you.
All right, thank you, Michelle. We're getting close, guys. You've been very patient. We're 35 minutes in. We maybe have another 5 to 10 minutes left. So a couple quick mentions on dental, vision, and a couple other programs. So first of all, we mentioned earlier the dental plan. You're getting an extra $500 a year in dental benefits. So that's awesome for everybody that exercises that, that uses that benefit. Recommend finding an in-network dentist through Emeritus. The website is listed not only in your guides, but up here on the screen. But basically, there's a deductible. It's a $50 single deductible, $150 family deductible. Now, if you're getting preventive coverage done, you're getting your annual teeth cleaning, x-rays, etc., that kind of stuff, that's actually paid at 100% and deductibles waived. But if you get anything that's listed in these basic services category or the major services category, there is a cost share. You do pay the deductible up front. So for instance, if you need to get fillings or crowns, root canals, all that kind of good stuff, that's paid at a 90% benefit. You pay 10% up to the max of $1,500. If it's a major service like inlays, onlays, bridges, implants, all that kind of good stuff, it's paid at 60%. There's also a orthodontia benefit, and I want to just make sure we set right expectations on this. You pay 50% of the orthodontia expenses or braces up to a max of $1,000 per child, and that's a lifetime max. So if you have any kids that are in waiting for braces, just want to be clear, the cost for braces is probably more in the $4,000 to $5,000 range. So this benefit doesn't pay for braces in its entirety, right? It pays a percentage of them, or about 1/4 or 1/5 of them. You can also roll over $250 per benefit period, up to a max of $1,000 if you don't hit your annual maximum, right? So that's good because a lot of us, usually we'll go a couple years without a major dental expense. And so if you can roll over those funds year to year, and then the event where you got to get, 2 crowns put in and a root canal and all that kind of good stuff, you've got that money banked away. So very cool rollover benefit. Any questions on the dental? All right, we'll move on to vision. Easy, no changes to the vision plan, right? We have a $10 exam copay for in-network doctors. We have a $25 materials copay. Frames are reimbursed up to a maximum of $130. By the way, frames is once every 2 years, right? But lenses, contact lenses, that's actually reimbursed at once every year. Okay, so the frames is once every 2 years. Everything else is once a year. But what's nice is your lenses and contact lenses, or the lenses rather, are covered in full. And the contact lenses for a fit and follow-up exam is a 15% discount. If they're elective, it'll reimburse up to $130. Or if it's medically necessary, it's covered in full. That's a little unique of a plan design on here, so that's very nice as well. Okay? Any questions on the vision plan? Here are your costs, and these are located in your open enrollment guides. Okay, we put in not only what you pay, but of course what the city of Lawrence pays as well. Tell you what, that high deductible healthcare plan in particular is a really good deal. About, if you're on single coverage, $30 twice a month, or about $60 a month for health insurance coverage. A very, very nice benefit to you all. We have the dental rates up there as well and the vision rates. Just a quick mention, in your open enrollment guides, there's a section in here that that just talks about the vision itself, and that's on page 16. Unfortunately, the rates didn't get printed accurately at the bottom of there. My apologies for that. But these rates that you see up on the screen, they're located a couple pages later on, I think it's page 32. It is, and those rates are accurate. So my apologies for the confusion, but these are the correct rates to use, okay, on the vision. Everything else is accurate, okay? Any questions? All right, we do have some other benefits offered. We do have the flexible spending account, a couple different options there. You can do the medical FSA, which allows you to be able to use tax advantage funds to pay for medical, dental, and vision expenses. Now, the medical FSA can only be used if you're on the PPO plan. You can actually exercise up to a max of $2,650. The limited FSA is available on both plans. That's for dental and vision expenses, max of $2,650. The dependent care FSA has a max of $5,000, and you can use that regardless of what plan you're on. Okay, so another great tax advantage product to be able to save for healthcare. Everybody gets $50,000 in basic life insurance. Everybody also gets $80,000 in accidental death and dismemberment. Both of those are at no cost to you. There's lots of voluntary programs. We're not going to go into all of those tonight because we just don't have enough time, but they are located in your benefit guides. All right, but we've got voluntary life and AD&D, voluntary short and long-term disability, critical illness, we have accident insurance, lots of other programs for you to take advantage of. And all the rates and benefits information are in your open enrollment guides. We also have access to an employee assistance program offered through Community Health that provides free confidential counseling services if you have a personal issue going on, a family issue, you need to talk to a counselor, certainly have the availability to do so. Phone number's up on the screen, and of course the information's available in your guide. Lastly, what to do next. So open enrollment is from November 13th through November 19th. You must enroll in the new enrollment system located in the HR portal. Now, this is an active enrollment. That means that even if you have no changes, you have to log into the system and click and elect your coverage or waive your coverage. But you got to go in the system and do it. Information on how to do that is in your open enrollment guides, of course. It's fairly simple. If you have any issues, of course, talk to Donita in the HR department. Please make sure to confirm and submit, and you will have the ability to print your confirmation statement. If you're interested in enrolling in the short-term or long-term disability, the voluntary life for your spouse or children, or critical illness for your spouse or children, there were some minor system limitations there. So just work with Donita in HR, and she can get you enrolled for those products. Any questions? Yes?
Are we getting new betting cards this year? If we are, or are we getting
I don't believe you are getting new Benny cards. The FSA administrator is staying the same, so I think it should be the same. Any other questions? Yes?
Just the HSA matching is,
Yep.
that's something that has to be paid like the $600 all at once, or is that just how much?
No?
throughout the
Oh, no, it's a great question. So you can fill that bucket up over time. So you can do $5 a paycheck or $20 a paycheck. Certainly don't need to do that all at once. Great question. Any other questions? Well, I know myself and Nick and Michelle and Barbara and others, we're going to be here for a couple minutes yet this evening. So if you have an individual situation, please come talk to us. If you're curious on which plan to choose, come talk to us. We'd be happy to give you any advice on that. Otherwise, thank you for your attention very much, and have a great rest of your evening.